How often does the body clear HPV after abnormal pap results? When you receive an abnormal pap test, it can be worrying, but it's important to know that your body often clears the human papillomavirus naturally. The immune system plays a key role in fighting off these infections, and most high-risk HPV infections tend to resolve on their own within a certain time frame. Research shows that many women with abnormal pap results, especially those with mild changes, will clear high-risk HPV types within 6 to 18 months. For example, about 25 to 41% of women with mild abnormalities clear the infection in this period. HPV-16, one of the most high-risk types linked to cervical cancer, tends to clear more slowly. Only about 19% of women with HPV-16 clear the infection after 18 months, whereas other high-risk types may clear at a rate of nearly 49% in the same time. Overall, studies indicate that more than half of high-risk HPV infections clear within 1 year to a year and a half after detection. The longer the infection persists, the higher the risk of developing cervical cell changes that could lead to precancer or cancer. Persistence is more common with certain high-risk types like HPV-16, HPV-18, HPV-31, and HPV-33, especially in women with abnormal pap results. However, many women still naturally clear these infections without treatment. Treatment of cervical abnormalities can influence HPV clearance. Women who have undergone treatment for precancerous changes often see about 50% clear the virus within 6 months, and this increases to around 67% after a year. As time passes after treatment, the chances of clearing HPV improve, reducing the risk of progression. Younger women and adolescents tend to clear HPV infections more quickly. Some studies report clearance rates as high as 80% in teenagers, which highlights how immune response varies with age and health status. In summary, after an abnormal pap test that indicates HPV infection or cervical cell changes, the body clears the virus in many cases within 1 to 2 years. The exact timing depends on the specific HPV type, the severity of cell changes, age, immune health, and whether treatment was given. Persistent infections requiring careful monitoring because they carry a higher risk of progressing to cervical cancer. It's always best to follow your healthcare provider's advice and attend regular screening appointments. These checkups help catch any persistent infections or early signs of changes so they can be managed promptly. Remember, each person's situation is unique, and your healthcare team can provide guidance tailored to your health needs.